about 95% of hysterectomies that are done could have been avoided and or are done unnecessarily.
The most common hormone imbalance that we have is estrogen dominance.
Unopposed, estrogen can be harmful, and then it becomes the angel of death.
People need to know that there's something out there that will balance us out.
Women do not have to live with PMS. They think they do.
To blame it on just the way things are of being a woman is a cop-out.
While menopause is an unavoidable stage of every woman's life, the years before its onset can pose serious health challenges, from hysterectomies to cancer. But a lot can be done naturally to avoid these risks. I'm Tia Marlier, and this is Alternative Medicine. Today we investigate premenopause. To start, Dr. Jessie Hanley explains when and why premenopause begins.
Premenopause is the time in a woman's life when her hormones begin to change. It could be as young as 25 if the woman is too thin, or if she is a marathon runner, or if her life is incredibly stressful, or it could be as late as 30, 35, 40 when a woman's hormones begin to change naturally in the movement towards menopause. It's natural for our hormones to start to change as the predecessor years before menopause is actually manifest clearly.
The woman may feel that her energy level is different. She may notice that she's become a little heavier. She may sense she has breast fullness and some breast tenderness. Her periods may change a little bit. She senses that there's some change in her body.
Acclaimed California physician Dr. John Lee is author of the popular book, What Your Doctor May Not Tell You About Menopause.
What's most commonly seen as a woman's hormones are changing away from what's optimal is that her progesterone levels usually begin to decline first, long in advance of estrogen. And it's the decline in progesterone, we believe, that causes the majority of the symptoms. And the majority of the symptoms, therefore, appear to be estrogen dominant, as John Lee would say, or estrogen excess symptoms.
Now let's meet Dr. David Zava, who has studied the effects that estrogen and progesterone can have on a woman during the premenopausal period of her life.
The second half of the cycle, where you normally have progesterone being produced, the ovaries are no longer able to produce that progesterone, but they continue to produce estrogen. So you have estrogen dominance. And this shows up as fibrocystic breast disease, PMS, those kinds of problems. And that's a very dangerous period in terms of cancer because it can increase the likelihood that a hit or damage will occur to the breast epithelium or to the uterus.
It isn't uncommon for a 33-year-old woman to come to my office and complain to me that this is the first time she's had any problem with her life, her health, or her body, and it's manifesting as PMS. All of a sudden, it seems to her that the day or a few days after ovulation, her entire mood changes, and that she's waking up to this problem, and her culture's telling her, oh, it's all in your mind, get used to it and get back to work. I think it's very sad that we diminish that we belittle the symptoms of PMS.
My symptoms of PMS became increasingly worse, and I think my husband would definitely agree because I just got more irritable right before, a week or so before I noticed, and I'd get backaches and more just slight anxiety attacks. You know, anything would set me off.
I was constantly apologizing for my actions, arguing with people. The littlest thing would set me off. And it was a horrible thing to have to do this month after month, have to go through this.
I think PMS is a gift in a way to a woman. It's a wake-up call. Stop and pay attention. This is my body. I need some attention. Stop and listen to what it is.
To just blame it on some design error in women, something that Mother Nature did to women, is a cop-out. To blame it on some stressful problem that she might be going through is a cop-out. To blame it on just the way things are of being a woman is a cop-out. And what must be found is a new understanding of the importance of these hormone balances, because you can help people. You can help them reestablish normal hormone balance.
And even though it may just be that a woman needs to add some natural progesterone to her diet, take some nutrients, and eat a whole foods diet, those three things make us stop and pay attention to ourselves and take better care of ourselves, that will snowball into a much healthier life.
Is estrogen the angel of life or the angel of death? We'll find out when Alternative Medicine continues. Through the proper balance of natural hormones, most women can avoid having to endure a hysterectomy. Dr. Handley explains.
About 95% of hysterectomies that are done could have been avoided and or are done unnecessarily. And although there are very few hysterectomies that are done for emergency reasons in a very young woman, the majority of hysterectomies that are done in women begin approximately the age of 35 and go on through menopause, and sometimes afterwards, but much more rarely. And they're usually done because a woman has started to grow fibroids and a doctor thinks it's a good idea to take the uterus out long before it's a problem and doesn't know what else to possibly do, he or she can possibly do to prevent the growth of fibroids. A lot of times hysterectomies are done because a woman starts having very heavy periods, and if nothing is done, if the symptoms aren't heeded, then oftentimes by the time menopause comes, we start hemorrhaging. And physicians don't know what else to do. Sometimes they'll run in and try and stop the dike with birth control pills, which may or may not be a better solution.
The usual scenario that you have with a woman who's perimenopausal is you go through this phase of estrogen excess. It causes a buildup of the uterine lining. A doctor says, oh, you know, your uterine lining is too thick. It predisposes you to cancer. So maybe we should have a hysterectomy. So they do a hysterectomy and they do oophorectomy. They remove the ovaries at the same time. The problem with that is that when you remove the uterus and the ovaries, is that overnight you drop the level of estrogen and progesterone and testosterone by half. Now that's significantly going to affect the quality of life. I think many women could avoid that problem of having a hysterectomy by using natural progesterone. They could have avoided it if they had to use it much earlier in life when they recognize that they have this problem.
Hysterectomies are done for irregular bleeding, problems that the doctor is not dealing with very effectively, and his teaching has not led him to understand the basic underlying metabolic dysfunction which is behind this. If he can't fix it with trying some birth control pills or some extra estrogen or something, his treatment is to remove it. I had a patient once that told me she first had her gallbladder removed when it acted up, then she had a hysterectomy when her uterus acted up and she had some irregular bleeding, and she had a breast removed because he found some unusual cells in there. And I told her, never tell your doctor that you have a headache.
If the symptoms and the signs are heeded earlier in life, when the fibroids first start growing, when periods first start getting abnormal, when excessive breast tenderness or PMS starts showing up, then it's so much easier to balance our hormones and avoid the need for a hysterectomy completely.
Most of the hysterectomies that I've seen done on women in the last 30 years are merely due to irregular periods, due to excess bleeding, clots forming. These are all signs of estrogen dominance. If he had known to check the progesterone level or to treat the progesterone and restore balance, the uterus will come back into balance. It wasn't the uterus' fault. The uterus is merely responding to the hormone imbalance.
For many years I had heavy periods with some problems, but as time went on they got heavier. I really didn't know that that was a problem until I went to the gynecologist, and I told him that my periods were getting heavier, and he said, "I think we should do a biopsy." And that frightened me. So we did the biopsy, and it turned out negative. Everything was okay. That was 5 years ago. I've seen the same doctor a few months ago, and everything is normal. And I told him about the progesterone and how my periods became normal. And they became normal after 2 months of using progesterone.
Very often, women who use natural progesterone will find that their first period after they're using it is a very heavy period, and that following this, it corrects itself, and you go back to more normal menstrual cycles.
When alternative medicine returns, we learn how the stresses of modern life can throw hormones out of balance. Stress, no matter where it comes from, can cause a serious imbalance of the hormones in the body, along with some unwanted consequences.
It's natural for the species under stress. Could be, and when I say stress, it could be physical stress, it could be emotional stress, it could be any type of dietary stress. The ovaries will shut down production of progesterone. It's just natural for the body to do that, because you don't want to reproduce during a time that the body is sensing stress. So you won't have production of progesterone.
In earlier times, in the crude way that I have of thinking about it, earlier times, stress might be a wolf at your door. It might be that you club and you fight what is your stressful. Now we have stresses that we can't fight in that way. These are stresses that come from sources that we can't touch.
Back in the days when we were in trees and foraging for fruit and so on, we jumped out of a tree and there was a saber-toothed tiger there. We had to get away real quick. We produced a lot of cortisol over a brief period of time, but then we had a chance to rest. Modern society has forced us into producing too much stress hormone persistently, so many of us are under chronic stress kinds of situations. This causes a feedback to the reproductive tissues, such as the ovaries, so that you will have less production of both estrogen and progesterone under these kinds of situations. And that's not good, because those hormones are necessary for nourishing the body.
The adrenal glands can suffer exhaustion. Adrenal exhaustion comes from long, ongoing, chronic, repetitive stress. It can result from a pregnancy. Women who have adrenal exhaustion at the time of the delivery of the baby are the ones who will have postpartum depression. It can come as a result of long, terrible, metabolic demanding surgery or illness, and you can end up with adrenal exhaustion. They would benefit by small doses of physiological real cortisol, just as I am also saying that women who are deficient in progesterone will benefit from small doses of real progesterone. People who are deficient in thyroid will benefit from small doses of that. And in the adrenal glands, it's a perfectly justifiable conclusion that sometimes a little extra cortisol may be needed.
Oftentimes women will come to me and say, I've felt well all my life until now, and understood how the cumulative stress and the wear and tear of the stress on their body and their organs has begun over time to affect them. The gland in our body that is most clearly affected by stress is our adrenals. Our adrenals strive to keep up with the demand, but over the years the wear and tear begins to make it so that they just can't keep up with the demand. And the part of that that affects our hormonal body most directly is that our adrenals also make estrogen, progesterone, testosterone, and that cortisol is part of what affects our mood, our health, and our body's ability to balance our other hormones. And so oftentimes in a protocol of a very stressed woman, which in my community in LA is the norm, I'll use either herbs or adrenal glandulars to help them build up and repair their adrenals, as well as encourage them to learn to meditate, or just to take a few minutes in the afternoon to take a 15-minute cat nap when their adrenals would most love the time to repair.
A simple home test can determine the level of progesterone production. Dr. Zava explains how it works.
If a woman is cyclically producing estrogen and not producing progesterone, then you can certainly see that in either a blood test or a saliva test. Saliva test is actually more accurate than a blood test. If a woman suspects that she's not producing adequate amounts of progesterone, she can pick a time during the second half of her cycle to take a look and find out whether she's producing adequate amounts of progesterone. You should have at least 100 to 200 times more progesterone at peak of production of progesterone than you have of estradiol being produced. In a natural cycle, that's a good balance. I say at least 100 to 200. If it's higher than that, that's fine too. Supplementation with progesterone would eliminate those problems, would eliminate the problem of having to have your uterus taken out 10 years down the road, would eliminate the likelihood that you're going to develop breast cancer 10 years down the road. So I think it's very important that women understand this, understand that some of these symptoms they're having are signs. Something can be done to correct those problems.
And that something is the balancing of hormones, in particular estrogen and progesterone, that leads to a much higher quality of life during the premenopause years. I'm Tia Marlier. Thanks for joining us today on Alternative Medicine.